So when we had our first daughter, Taylor, I went with an OB at St. Luke's. I adored her. She was great. About midway through my second pregnancy, she said, "Sorry, Katie, but I'm leaving town." So I had to start anew, and I thought it was a good reason to try a nurse midwife. And the reason I went with a midwife was because in our first birth with Taylor, I adored the nurse who was with us, and she was really instrumental in helping get us through it and taking through, and she was just great. So I thought, why not take the nurse to the next level and get the certified midwife? The times I felt I needed her was really at the appointments to talk about what was going on. Like, I'm not sleeping, I don't feel well, my legs hurt, my feet are swollen, all of those glorious pregnancy symptoms. So she was great at listening.
Yeah, and I think the midwife has, based on her, training as in the nursing field, has a little bit more of an opportunity to give that, again, much more personal, compassionate care.
When it came time for getting ready for the birth, then she had a whole birth plan ready for us. All of the questions, things I had never even thought of. But it was great to know ahead of time those were our options. And she was really good about making sure everyone at the hospital had that sheet and was prepared for us. The first time, like I said, we adored our OB, but I really felt like it was her plan, and whereas this experience was definitely ours.
They kept the lights dim versus, full exposure to where you felt like you were in an operating room on the first one, where the second one you really did feel like you were in a labor and delivery, something that was a little bit more peaceful. It was very quiet. The baby stayed with her for an extended period of time while they actually worked around their experience together.
It was just so nice. It was relaxed, wonderful. Just that time with me and the baby and Joe. And yes, I'm healthy. I have no risk factors per se, but something could happen. And the last thing I wanted to do was put my baby or myself at risk. And so it was so important that we would have that support structure at St. Luke's, where there was a NICU down the hall. There were physicians who could take care of us. There was everything. So really having a midwife was like having our cake and eating it too. We got that personal, comforting experience that was very homey in a hospital facility. You have all the same options that you would. If I wanted an epidural, I could have gotten one. If you want someone who is going to be really very personable, involved, and there, a midwife is a great option. I wouldn't do this again without a midwife.